Okay, seriously, someone tell me this is a joke. Medicare is ditching telehealth flexibilities. Like, come on, haven't doctors suffered enough?
It's true, I'm afraid. Starting in April 2025, a lot of those pandemic era virtual care allowances, well, they're going away. Gone.
You're kidding. So right when we've all gotten used to, rocking pajamas at doctor's appointments, they yank it away. Talk about bad timing, huh?
It does seem a bit backwards, doesn't it? Remember the CARES Act back at the start of the pandemic, making telehealth the big thing? Now it feels like we're going way back in time.
Yeah, I can still remember those early pandemic days, freaking out on Zoom with my doctor over a sniffle. Good times, right?
Everyone was figuring it out on the fly. But the crazy thing is, it actually worked. There's this Avalere study that shows telehealth just exploded during that time. Think about it. Back in 2019, like the Stone Age, only 0.13% of primary care visits in Medicare were virtual.
0.13%. You practically had to send a smoke signal to get a refill back then.
Right. But now jump to 2023 and it's up to like 2%. It's a total transformation. Millions more appointments happening virtually.
Okay, so telehealth went from zero to hero super fast. But was it all kinds of appointments? Or just like cough into the phone checkups?
Well, this Avalere study actually breaks it down, comparing new patient visits to established ones. And you know what? Those follow-up visits, the comfy ones, those were way more likely to be virtual, almost 2% in 2023.
Yeah, that makes sense. Once you know your doctor, you don't always need the whole like in-person song and dance. But what about those first-time appointments? Did they stay in person?
Even new patient visits saw a jump, reaching 0.6% in 2023. So even that first meeting, it went digital, at least a little bit.
Wow, so even those first impressions with a new doctor going digital? I guess some things don't need a stethoscope, huh? But hold on, you mentioned something about the study breaking things down by specialty. Did everyone jump on the telehealth train equally?
That's where it gets really interesting. Get this. Preventive medicine was actually the biggest user, with a whole 7% of services going virtual in 2023. You'd think checkups would be all about, the hands-on stuff.
Wait, so the doctors who are all about healthy living, they were the first to go digital. That's kind of ironic, isn't it?
It is, right. And on the flip side, family practice lagged behind, only 1.7% of visits going virtual. Maybe they do need to see you in person for those sniffles.
Well, at least hypochondriacs can breathe a sigh of relief. But it sounds like telehealth was doing great until Medicare decided to mess things up. So what's next? Back to the waiting rooms for everyone.
Don't worry, it's not all bad news. According to telehealth.hhf.gov, some changes are temporary and some, especially for mental health, are here to stay.
That's great news for mental health, frankly. It's about time we realize that therapy and counseling can work really well online.
Exactly. And there's a lot of nuance to these policy shifts. Some are about what kind of services doctors can offer virtually and, of course, how they can bill for them.
Ah, billing. Can't have healthcare without the billing headaches, right?
It seems that way, doesn't it? But we'll save that fun for part 2 of our deep dive. Stay tuned for more bureaucratic excitement. So, picking up where we left off, it's the always exciting world of healthcare billing, right? It's enough to make anyone's head spin, even if you're a doctor.
Totally. It's like a maze you can never escape.
Mm-hmm.
And with all these telehealth changes, they're just making the maze bigger and more confusing, aren't they?
Yeah, it's definitely gotten more complex, especially for practices that are trying to stay on top of what they can bill for and how to actually do it.
Ugh, it's a huge headache just thinking about it.
Yeah.
So give it to me straight. What are the biggest billing changes that are going to trip doctors up?
Well, one of the big ones is that some of those relaxed rules about where patients could be for telehealth appointments, those are going away. You remember how Medicare patients could basically be anywhere, even like in their bathtub for a virtual visit?
Yeah, those were the days. Doctor's appointments in your PJs. It's a pretty good time.
I know, right? But those days might be over. Some location restrictions are coming back, which means doctors have to be really careful about where their patients are during those virtual appointments. And of course, they need to make sure they're using the right billing codes for every situation.
So basically, more paperwork, more chances to make mistakes, more stress for everyone. Sounds like a typical day in healthcare.
Yeah, it's not the best situation, but it's what we're dealing with. And this is why it's so important for practices to really get a handle on these new rules, have a system in place to make sure their billing is accurate. If they don't, they're going to be drowning in rejected claims and losing money.
So what does all this mean for the patients, for us? Are we going to have to go back to those packed waiting rooms and endless hold music when we try to make an appointment?
It's not all bad, I promise. While some things are getting stricter with telehealth, It's not disappearing completely. And like we talked about before, for mental health, it's actually getting even easier to access.
Okay, that's good to hear. So maybe it's like telehealth is going through a teenage phase.
Yeah, that's a good way to put it. It's growing up, finding its place, but it's going to have some bumps along the way. And what it looks like for you is going to depend on, your own needs and situation.
So for us regular people trying to figure out all this telehealth craziness, what should we be doing?
The most important thing is to just talk to your doctor. Be proactive. Ask them about their telehealth policies, like which services they offer virtually and what their billing process is like. Don't be afraid to, speak up for what you need.
Good point. Information is power, especially when it comes to healthcare. And if we're totally lost with all this billing stuff, are there any resources that can help us decode it all?
Definitely. There are services out there that specialize in helping practices navigate all this complexity, like human medical billing, for example. They help practices stay on top of all the billing rules so doctors can, focus on taking care of their patients.
That sounds incredibly helpful for any practice that's struggling to keep up with all these changes.
Yeah, exactly. It frees up doctors to spend less time on billing and more time with their patients, which is how it should be.
Well, that's good to know. It seems like the future of telehealth is still a bit up in the air. But if we plan ahead and get some help from the experts, maybe we can get through all this without too much trouble.
I agree. And who knows, maybe all these growing pains will actually lead to an even better, more accessible telehealth system in the future.
Fingers crossed. We've covered a lot of ground here, but we're not done yet. In part 3, we'll be looking at the bigger picture of these telehealth policy changes and what they might mean for the future of virtual care. So stick around. Okay, so we're back for the final part of our telehealth deep dive. We've talked about the flexibilities going away, the billing nightmares, and that feeling of what's happening. It's kind of hitting everyone in healthcare right now. But beyond what it means for doctors and patients right now, are there like bigger things we should be thinking about?
Absolutely. I think this really brings up the whole issue of healthcare access, and whether it's really fair for everyone. Remember how telehealth was a big deal during the pandemic, especially for people in areas where it's hard to get good care?
Yeah, it's like suddenly it didn't matter where you lived, you could still get quality care. People who maybe had trouble seeing a specialist or even their regular doctor, they could suddenly connect online. It felt like things were getting a little more equal.
Exactly. But with some of those flexibilities going away, there's this worry that, well, that gap in healthcare is going to get wider again. The people who are already having trouble getting care, whether it's because of where they live or how much money they make or other things, they could end up even worse off.
That's kind of scary to think about. So it's not just about convenience anymore. It's about making sure everyone has a chance to get the care they need no matter what.
Right. And this brings up another big question. What's the role of telehealth going to be in the future? Is it just a temporary thing, like a pandemic fad that's going to fade away? Or is it something more like a whole new way of thinking about how we get care?
I mean, it feels like we can't just go back now. People have seen how convenient telehealth can be,
Mm,
and I don't think they're going to want to give that up.
I agree. And the technology is just getting better and better. We're seeing amazing new things in remote patient monitoring, AI that can help diagnose problems, all sorts of things that are pushing the limits of what we can do with virtual care.
So maybe all these problems we're having, maybe it's just a sign that telehealth is growing up, finding its place.
That's one way to look at it. In the end, it's all about finding that balance between the convenience and the cost savings of telehealth and knowing when in-person care is really necessary.
Yeah, finding that balance is going to be key if we want a healthcare system that works for everyone. But like we've talked about, figuring out this whole telehealth thing can be really confusing, especially with the billing changes. Any last bits of advice for our listeners?
Definitely. For doctors, remember that there's help out there to keep up with all the billing stuff so you can focus on what you do best, which is taking care of patients. And for patients, don't be afraid to ask your doctor about their telehealth policies and what they offer. Speak up for what you need.
Great advice. Sounds like the future of telehealth is still being written, but it's up to all of us, doctors, patients, policymakers, the people making the technology to figure it out. And if you're feeling lost with all this billing stuff, remember, Human Medical Billing is offering a free practice analysis, so check it out. Until next time, stay informed, stay curious, and stay healthy.